the podiatrist for Commonwealth Orthopaedic Centers based in Northern Kentucky. And one of the questions that I get from a lot of patients are, why did I get this ingrown toenail and how should I be cutting my nails? And we'll try to address that with this video today. So we'll use this drawing so we can learn some anatomy. This is a toe, obviously, and this is the nail coming up. And the first part of the anatomy I want you to understand is about the nail. The nail is very similar to hair, and everybody knows the structure of hair. There's a root underneath the scalp. That's the only part that's alive. The live root pushes and the dead shaft gets pushed, and that's what you see here. The root of the nail is under the skin in this area. That's the only live part. This pushes and that gets pushed, and that's really all you need to know. The second part of the anatomy you need to understand is the skin. The outside layer of the skin, everybody knows, is called the epidermis. And the epidermis is really 5 layers thick when you look at it under a microscope. And that's a good covering for the body. It keeps you in, it keeps other people out. The place where it's not 5 layers thick is underneath the nail. And if you've been under that nail, you know that's very pink and very soft and very thin. If you look under a microscope, instead of 5 layers, it's only the bottom 2 layers. The other 3 layers are kind of a pile of dead cells on the top of it that provide cover. And what the body seems to figure is that with a nail on top of it, it does not need that extra 3 layers. If you knock the nail off, or if I take it off, the body says, I don't want just a 2-layer outside. And so it turns around and puts the extra 3 layers on so that you're now protected even without a nail. That's the anatomy you need to know. Let's talk about this now. So on a normal side, what you're going to have is 5-layer epidermis like this, and the root pushing the nail over the top of 2-layer epidermis like this. And what we want you to do by cutting straight across is to cut this corner above the skin. And as long as you do that, you won't get an ingrown nail. This skin and this nail will hold each other apart, and everything works very well. And we don't care really how long or how short the nail is, as long as you're above that area. So when people say cut your nail straight across, that's really what they want you to do, is they want you to use the clipper like that. Now, what people do when they have a problem usually is they have a nail that, instead of being straight across like that, is curved down. And that's done a number of ways. Sometimes people have a trauma that causes part of the nail to come off. Sometimes, especially with older people, nails get thick for a number of reasons. Sometimes they're just cut wrong, and sometimes you're born in a way that that nail curves way down. For whatever the case, when you have a nail like that, this 5-layer epidermis is normal, but here is supposed to be 2-layer with a nail on it. And the body says, I want to protect that, and this becomes the problem. That now as this pushes, it's not pushing over the top of the 2-layer thin skin. There's a thick piece in front of it, and it pushes right up into it. So what the person does then is they start to cut down rounded, which is the wrong way to cut this. You want to cut straight across, not bury the tips and cut down rounded. And what they'll do is, as it starts to hurt right about here, they'll leave a piece, and as this pushes, it will push it right up through the skin, and that's the classic ingrown toenail. The reason this has pus is because there's a tack in your skin. And my job as a doctor would be how to get that out of there so that it doesn't cause that infection. But here's the trick to this. If you can cut this straight across, like this is the A answer. It's the best way to do it. But some people who already have their nails like this will say, I can't do that. And the next thing to do then is to cut the nail wrong on purpose. That's to bury the tip of the instrument and try to cut that piece off. And if you can do that without getting an infection, without creating pain, without creating a break in the skin, then that will work for you. Now, as that gets worse and worse, you may get to the point where you need part of the nail or even all of the nail taken off permanently, and that would be a job for a podiatrist or a professional to do. So hopefully what we've learned from this is to cut the nail straight across if we can, to cut the nail rounded on purpose if you have to as an alternative, and to come see a podiatrist if there are any problems or questions beyond that. Again, I'm Dr. Matt Connolly with Commonwealth Orthopaedics.